Hello.
Hi.
How are you?
Good. How are you?
My name is Alessandra. I am the nurse practitioner student taking care of you today. I'm going to go ahead and wash my hands before your assessment.
Thank you.
Okay, so today I'm going to go ahead and do a full head-to-toe assessment on you. All of this, everything that I do today is kept private. Okay. So the first thing I'm going to do is I'm going to go ahead and see about your skin color. There's no cyanosis, no jaundice, and you are congruent with your ethnicity. I'm going to go ahead and look at your texture. The texture of your skin is soft. It's good and moist. You have appropriate turgor and mobility. There are no lesions, scars. I don't see any birthmarks or freckles. I do, however, see a tattoo on your right upper extremity. Now I'm going to see your nails, the shape of your nails. Okay. The angle of attachment is at 180 degrees. There's no pitting, no thickness, no lesions. And your capillary refill is less than 3 seconds.
Is that good?
Yes, it's perfect. Excellent. Now I'm going to check your hair. You have normal distribution. Your hair is thin and fine. There are no scales nor dandruff or lesions. Your head is normal cephalic. You have a normal contour. And I don't see any deformities. Can I see on that side too? Okay. And can you look at me? Okay. Your face is symmetric. You have a normal facial expression. Can you smile for me? You have no involuntary movements. Now I'm going to go ahead and start with the cranial nerves. I'm going to check cranial nerve number 5. So go ahead and clench your teeth. Okay. Now it's bilateral. It's good on both sides. Now I'm going to check your corneal reflex, which I would put a cotton to your eye and you would blink. And now I'm going to check cranial nerve number 7. Squeeze your eyes shut. Raise your eyebrows. Wrinkle your forehead. And frown and puff your cheeks. Continuing on with our assessment.
Perfect.
I'm going to assess your sinuses. I'm going to assess your frontal and also your maxillary sinuses. I'm now going to focus on your eyes. So for cranial nerve 2, we're going to use the Snellen chart. You can keep your glasses on if you would like. Can you read the last line?
DEFPOTEC.
Perfect. So you have 20/20 vision correctly. Now I'm going to test you for your visual field. I'm going to put out my hands. I'm going to wiggle, and you tell me when you see them.
No.
Great. Can you take off your glasses for me? Because I would like to check your eyebrows and eyelids. So you have no lesions in your eyebrows, and your eyelashes and your eyebrows are within normal limits. You don't have any styes in your eyelids, and you have normal hair distribution. You don't have any swelling or discharge coming out of your lacrimal ducts. Your eyes and your skin is pink, and there's no jaundice in your conjunctiva or your sclera. There's no opacity or cataracts in your cornea. Your iris is green. There are no shadows. Your pupil size is of 3 millimeters and they're symmetrical. Now I'm going to test your pupils. Just look at me. Okay. Your pupils are equal, round, reactive to light, and accommodation. Now I'm going to test you for cranial nerve 3, 4, and 6. I'm going to make an H with my finger and just go ahead and follow it. Ready? Now keep looking at my finger. Okay. I also tested you for your convergence. Your pupils do constrict and they're symmetric and normal. Now I'm going to check your red reflex. The room is darkened.
Go.
Okay, everything is normal. I see all your veins and arteries. There are no lesions in the retina. The optic disc is orange with sharp edges, and your physiological cup is within normal limits. A good cup to disc ratio. There's no papilledema. Now we're going to move on to your ears. Okay, So your ears are symmetrical. They are normal in size and shape. There are no lesions or deformities, and they're in line with your eyes. I'm gonna go ahead and tug on your ear, and you let me know if there's any pain.
Mm.
Okay, so no pain is normal. I'm gonna go ahead and take a look inside of your ear. Okay, so I see no discharge, no foreign bodies. There's a normal amount of cerumen, and there's no swelling in your ear canal. I also saw your tympanic membrane, and it was intact. It was pearly gray, shiny, and there was no bulging. I did also see the cone of light, and I saw all the bony landmarks. Now I'm going to test you for cranial nerve 8. Go ahead and cover your ear. I'm going to go ahead and snap the fingers.
Okay.
Cover the other ear. Do you hear it?
Yes.
Okay, great. Now I'm going to go ahead and do the Weber test.
Okay.
I'm going to hit this tuning fork and put it on your head. You're going to let me know if the sound goes more right or left.
Sure. I hear the sound equally on both sides.
Okay, so there's no lateralization, which is equal or normal. Now I'm going to do the Ryan test. I'm going to hit it. I'm going to put it on behind your ear, and then I'm going to put it in the air. You tell me when you stop hearing the noise, okay? Tell me when it stops.
Stops. Okay, stops.
Okay, that's normal because air conduction is 2 times greater than the bone conduction. Now I'm going to assess your nose. Your nose is symmetric. There's no deformities. Your airway is patent. Is there any tenderness on your nose? No. Okay. I'm going to go ahead and look inside. You have a normal turbinate size. They're pink. There's no swelling, bleeding, or exudates or polyps. Your septum I saw was at midline. There's no inflammation or perforation. And now, last but not least, cranial nerve 1. And now I'm going to have you smell coffee beans, okay? Tell me when you smell it.
So I close my eyes, or?
Whatever you want. Are you able to smell it?
Yes.
Okay, perfect. I'm going to assess your mouth. Your lips are pink and moist. I don't see any lumps or cracking. Can I see, I'm going to go ahead and look at the inside of your mouth. Open and say, ah. Okay, you have a pink oral mucosa. There are not any nodules or white patches, and your gums are pink. I don't see any swelling or ulcers on the gums. Your teeth are white. Can I see inside? I want to see your other teeth. Okay. I don't see any decay, loose teeth, or fillings. Your palate is pink without lesions. Your tongue is also pink with a normal texture, and you don't have any lesions on your tongue either. I'm going to go ahead and test your cranial nerve 12. So can you stick out your tongue for me and move it side to side? Perfect. And now I'm going to test cranial nerve 9 and 10. Can you say ah for me?
Ah.
Can you swallow? I'm going to go ahead and elicit your gag reflex. Okay, great. Your saliva is clear, thin, and colorless, and I don't see any swelling or exudates in your tonsils. Now for your neck, I'm going to go ahead and test your cranial nerve 2. Go ahead and shrug your shoulders. I'm going to provide a resistance. Don't let me push them down. Okay, that's normal. Now I'm going to check your thyroid. Go ahead and swallow. Okay, that's normal. And you're not complaining about any tenderness. Okay, I'm going to go ahead and auscultate your thyroid to hear for any bruise. No bruise heard. Your trachea is midline and not deviated. I'm going to go ahead and palpate your carotid. And now I'm going to listen to your carotid because I want to hear bruise there too. Or I don't want to hear them. no bruise noted. Now I'm going to test out your lymph nodes. I'm going to go ahead and do your preauricular, your postauricular, your occipital, your tonsillar, submental, anterior cervical, posterior cervical, supraclavicular, and now I'm going to do the epitrochlear, okay, all within normal limits. Now I'm going to inspect your anterior chest. I don't see any skin lesions. Your chest is symmetrical. I see that your respirations are regular and you're not using any of your accessory muscles. You are not in any respiratory distress. I can see that your AP diameter is 1 to 2, which is normal. Now I'm going to feel on your chest. There's no tenderness, no crepitus, no thrills, heaves, or lifts. Now I'm going to auscultate. First, I'm going to auscultate your PMI. Which is in the fifth intercostal space midclavicular line. The diameter is going to be less than 3. Now I'm going to go ahead and auscultate the landmarks of the heart. So I'm going to do the aortic, pulmonic, tricuspid, and mitral. And now I'm going to inspect your posterior chest. So with your posterior chest, you don't have any lesions or any scars. You have a normal curvature of your cervical, thoracic, and your lumbar spine. And I don't see that you have any spinal tenderness. Now I'm going to ask you to say 99. I'm going to test your tactile fragmentus.
99, 99, 99, 99.
Great. Now I'm going to auscultate for your breath sounds. Breathe normal. Using the ladder approach, I hear that your breath sounds are clear posterior. Now I'm going to hear this into anterior. And using the ladder approach, your breath sounds are clear anterior and posterior. And now I'm going to assess your abdomen. I see that your abdomen is symmetrical. There are no lesions, scars, no dilated veins or rashes. So far it's not, I don't see any distension. There's no visible paralysis, bulging, or visible hernias. So now I'm going to go ahead and auscultate. I'm going to go ahead and go counterclockwise when I'm auscultating your 4 quadrants. And you have great vowel sounds. Now I'm going to auscultate your aortic artery, renal, iliac, and then your femoral. And now I'm going to go ahead and percuss your abdomen. Okay. So upon percussion, I'm going to hear tympani in your abdomen. And now I'm going to percuss your spleen. I'm going to go to the mid-trough space and the 5th intercostal space. A little bit, yeah. That's good. Okay. Until I hear. Now, hold your breath. Okay. Now I'm going to palpate. First, I'm going to do a light palpation. Just with one hand. And now I'm going to do a deep palpation with 2 hands. Now I'm going to try to palpate the spleen. I shouldn't feel anything though. Hold your breath. And now I'm going to palpate your liver. Hold your breath. Okay, you have regular borders and it's non-tender. Now I'm going to assess your V-bone tenderness. Does this hurt? Is it painful? Now I'm going to assess your roving sign. So I'm going to palpate your left lower quadrant. Is this painful? And now for your psoas sign, can you go ahead and pick up your leg? I'm going to provide resistance. Do you have any pain? And now I'm going to do the obturator sign. So I'm going to externally or internally rotate your hip. Nothing. Okay. Now I'm going to go ahead and evaluate your extremities. I don't see any skin lesions, scars, or ulcerations. I see that you have normal hair distribution, temperature, and color. There's no edema and no vascular irregularities. Now I'm going to go ahead and palpate your arteries. So I'm going to palpate your radial, your brachial, your femoral, your popliteal behind the knee, your dorsalis pedis on top of the foot, and your posterior tibialis. Now I'm going to test your muscle strength. Can you go ahead and sit for me? Yeah, just like that. Okay. Can you give me your arm? Now I'm going to provide resistance. Don't let me push down. Okay. And now why don't you push on my arm? Other side. Push on my arm. Provide resistance. Now for your legs, provide resistance. And okay. And how about provide resistance? Same thing with your dorsal. Provide resistance. And provide resistance. Okay. Now I'm going to go ahead and evaluate your nervous system. Do you know where you are?
Yes. Library at University of Miami.
What's your name?
Christopher Newhart.
And what date is it?
Today, well, I've been stressed, so I'm not sure what day it is.
Tuesday.
Today's Tuesday.
Welcome. Okay. Now we're going to do rapid alternating. So I want you to pronate and supinate your hands very fast. Very fast. Okay, perfect. And now I'm going to have you, every time that I move my finger, you're going to touch my finger, then you're going to touch your nose. Okay, ready? Perfect. Now I want to go ahead and test your gait. So why don't you go ahead, okay? So walk a normal line for me. A normal line. Okay? And now walk on your heels. And now walk on your toes. Okay, and now walk tandem. Okay, and now go ahead and stay here. We're going to do the Romberg sign. So open your eyes and bring out your hands. Now close your eyes. Okay, your balance is perfect. Now we're going to do the pronator drift. So go ahead and put your hands out, palms up, and now close your eyes. Perfect. Now I'm going to do the sensation if you want to go ahead and sit. So the light, I'm going to go ahead and do a light sensation. So close your eyes. Tell me what you feel, where you feel it.
Right forearm.
Okay.
Right leg, lower leg. Left thigh, quadriceps.
Perfect. Now I'm going to test your vibrating sensation. I'm going to go ahead and put the tuning fork on you. You're going to tell me where you hear it or feel it.
Left quad, right quad, lower right.
Okay. And now I'm going to do the discriminatory sensation. So I'm going to press, I'm going to have some points pressed on you. You're going to tell me how many there are. How many?
2.
Great. Now I'm going to test you for your stereognosis. I'm going to put something in your hand and you're going to tell me what it is.
Penny.
Perfect. Now I'm going to do graphesthesia. I'm going to draw something on your hand and you're going to tell me what it is.
Number 8.
Perfect. Now I'm going to do your deep tendon reflexes. The first one is going to be the brachioradialis. Perfect. I'm going to do your bicep. And I can see your bicep is contracting. Now I'm going to do your tricep. Let loose. Perfect. Now I'm gonna do your knee. Can you go ahead and yeah, dangle your knees? I know you guys can't see it, but he does have a great deep tendon reflex for his knee. And now your ankle. Now we will do ankle and plantar reflex.